Hey guys, welcome back to my channel. I hope you guys are having a fantastic day wherever you are in the world. Today I have my best friend Beth with me, and I'm doing a different type of video than I have ever done on my channel before. It is a Q&A with somebody else. This month is the National Diabetes Awareness Month.
Yes.
It is November, and so I have my diabetic friend.
My diabetic here.
Yay! That sounds so weird, but I was like, I don't know what else to. My friend who is a diabetic to answer some questions about what diabetes is and the whole kind of, I guess, systematic approach to it, so that you guys have some more knowledge about what diabetes is in honor of National Diabetes Awareness Month. Woo! Woo! Okay. First question. When were you diagnosed?
I was diagnosed in 2005.
Okay.
I was 9 years old, and I was living in Norfolk, Virginia, so I went to like a children's hospital there, and I stayed for probably like 3 or 4 days to do like a lot of teaching and education and stuff. So.
Okay. And you are now 24.
Yes, I'm now 24, so it's been 15 years. In September.
Yeah. All right. 15 years.
Yeah.
So would you mind explaining kind of an overview or the basics of what diabetes is? Obviously this video is a shorter video, so you're not going to get a whole scope of what diabetes is and all of the details. But to be informed, go and do your own research. But here is the basics of what diabetes is.
Yeah, I can do the basics. If you want more in depth, like that could be like a 2-hour-long presentation. But
we don't have that long. It's a YouTube video.
Yeah. So basically, I have type 1 diabetes, which means that it's an autoimmune disease where my body attacked the cells in my pancreas that make insulin, so my body no longer makes any more insulin, like at all. Your body needs insulin to regulate your blood glucose level, so that can be affected by eating carbohydrates, it can be affected by exercise, it can be affected by hormones, and so normally your pancreas would release insulin, and that would lower the glucose level in your bloodstream. But I don't make any insulin myself, so I have to manually inject it, and there are many different ways you can do that, which we'll talk about. But yeah, I have to take insulin all the time.
Okay. So what you explained a little bit of what type 1 is. There's a lot of, I guess, stigma between diabetes, of hearing somebody that has diabetes, because a lot of people assume it just means that they're unhealthy. But there is a difference between type 1 and type 2, and it doesn't always mean that you were just unhealthy.
Right. Yeah.
Would you like to explain that?
Yeah. So type 1 or type 2, I think both, like neither of them mean that you're like unhealthy. But type 2 diabetes is a little different. It's your body still produces some insulin. It's just not enough to kind of cover your whole body. So a lot of times you can control that more with like an oral medication, or with like exercise and, you know, regulating what you're eating. Whereas like type 1 diabetes, like really the only thing that you can do those other things as well, but you have to take insulin because your body literally has none. So.
Okay, a follow-up question on the difference between type 1 and type 2.
Yes.
Type 1 is typically genetic, right? In the sense of like you're born with it. It's not something that you can outgrow or change. But type 2 you can, correct?
Yeah. Yep.
Right.
Yeah.
And I say that there's type 1 and type 2. That's because those are the two main categories of diabetes. But there's also other forms like when you're pregnant, which I don't remember what the official term is.
Gestational diabetes. There's LADA diabetes, which I can't remember the exact letters it stands for, but it's basically like a late adult onset diabetes. Okay. And that it just like presents itself in a different way. There's types of diabetes that you can have after you've had like pancreatic cancer, or like your pancreas removed. Like some people have had to have that, and so, you know, then they don't have insulin. I think that's like type 3. I don't know. All the factual. There's
like we said, do
there's
your
many
own
different
research.
types. Yeah. So there's not just type 1 and type 2.
But those are the 2 very common and well-known variations of diabetes.
Yeah.
So those are typically the 2 that you hear people talk about.
Mm-hmm.
But I did want to acknowledge the fact that there are many different types of diabetes that anybody can get.
Right. Yeah.
And you can also be pre-diabetic.
Yes.
Only with type 2 though.
Yeah, mostly with type 2 diabetes. I think that's where a lot of the like stigma comes from, that people say like, oh, like if you eat so much sugar, like you're gonna get diabetes, and which isn't necessarily the case for either one, and it's not necessarily the case for type 2 as well. Like you can have like genetic predispositions for type 2 diabetes, but it's not a genetic disease, like an autoimmune disease.
Which is like type 1.
Yeah.
Okay, that was
a little technical in there.
Technical, yes. And so the follow-up question is, or another follow-up question is, can you outgrow it?
Type 1 diabetes, no. As of now, there's not really like a way to reverse it, I guess. Hopefully there's some research going on with like ways
Fingers
to make
crossed.
your body produce insulin again. But type 1 diabetes, it can't be reversed. There's no cure currently.
And type 2 though can?
Yeah,
to
essentially.
an extent. Okay.
Yeah.
Also with gestational diabetes, that is typically only when you're pregnant. So that you outgrow that when you give birth.
Yeah.
But the other ones I don't know much about either. Okay, so what can be done to reduce the risk of diabetes?
Yeah, as far as type 1, nothing. Really. Definitely though, and we'll talk about this too, but like knowing the warning signs for type 1 so that you are maybe like not quite so sick when you are diagnosed. I think other risk factors are just like healthy eating, exercising, like maintaining like a balanced weight, those kind of things. Yeah.
The next question is, what are the common symptoms of diabetes? Which ones were the ones that you had that kind of caused you to go in and see what was going on?
Yeah.
And what are the ones that you still have today?
Yeah. So common symptoms would be increased thirst, increased urination, extreme weight loss, fatigue. Those are usually like the 4 kind of big ones to notice. So for me, when I was diagnosed, I was going to the bathroom. I was peeing like constantly.
She still does.
Like constantly, yeah. So I still do pee a lot. But like I was getting up in the middle of the night like 6 times, just throughout the night. Yeah, and that's what my mom was noticing. And then also I was losing weight, I was fatigued, but like those aren't the things that you really notice as much at the time. I remember being like extremely thirsty. Like I remember being in like a grocery store with my mom and like almost throwing a tantrum, and like I was 9, so like not really tantrum age, because I wanted a bottle of water. Like at the counter, at the checkout counter, I was like, I have to have water. Like, I have to have it. And like I almost like lost my mind because my mom didn't want to get it. I don't even know what was happening, but it was like really thirsty, peeing a lot. So my mom decided to take me to like a local like urgent care the next day, and they checked my blood sugar and they check for ketones in your urine, which is not a good thing, and they were like, you have diabetes and you need to go to the hospital. So I didn't like go in an ambulance or anything. Like we actually went home and like packed a bag and then went to the hospital. And then I got like an IV so they could do like some fluids because you're very like dehydrated, and just started learning all about it. Mostly, I mean, I was learning stuff, but
mostly
like my parents were learning a lot of the stuff. But like you talk to a dietitian, you learn about reading nutrition labels and counting carbs and all the math that's involved with insulin, like calculating how much insulin you need. Yeah.
I have a follow-up question to this.
Yeah.
Beth has another friend named Mary who recently, within the last couple of years, found out that she was diabetic. So at a very different age than Beth was.
Yeah.
Did she get the same kind of treatment and explanation, like going to the hospital? Or was that mainly for children?
That's crazy. You can be diagnosed at any age.
Okay.
Like, my friend was diagnosed and she was
22?
21, 22. It was her
Okay.
senior year of college. And then I know people that were, like, diagnosed as an infant. Like, you know, basically, like, your parents are doing everything from infancy until, I don't know, whenever you start getting old enough to do your own injections. I don't know. That's a little crazy to me because it took me a while and I was 9. Like, my mom was doing a lot of the injections for me. But yeah, as far as my friend that was diagnosed older, she just went to her doctor's office and, like, at her doctor's office, they, like, gave her syringes and were like, this is how you do it. All right, do it now. Like, they made her do one, like, right then in front of her, and she just, like, went home with syringes and insulin and, like, and she had, like, a follow-up with, like, an endocrinologist and a diabetes educator, like, later. But, like, her first week at home, like,
she was on her own.
Yeah. You're just given some syringes and insulin and, like, go for it. I mean, I don't know if that's the case for everybody, like, diagnosed older, but that was crazy to me. I was like, what? Because she was texting me all this stuff. And I'm
glad that she had you.
Yeah.
I'm glad that she had you.
It just seems so crazy to me because, you know, a lot of times when you're younger, you know, you get all the, like, education. And I think eventually, like, she had more appointments and stuff, but...
Well, that's
yeah, that sounded a little crazy. Like, I can't imagine that.
So, I'm going to ask you 2 definitions of things that you have mentioned in your explanations.
Yes.
Ketones.
Okay.
And what is an I can't say the word, see?
Yeah, endocrinologist.
Endocrinologist.
Yeah. So ketones are basically when your body doesn't have any insulin. You can get ketones in your bloodstream, and it's like the breakdown of, like, fat and protein in your body releases ketones. So it's when a whole complicated thing that you can learn about in anatomy and biology.
Or on the internet.
That I won't explain. But basically, ketones can be released in your blood or in your urine, and it kind of is essentially like your blood is getting too acidic almost. So you start to feel really bad when you have ketones. You feel nauseous, you feel fatigued, you get, like, this weird, they call it, like, fruity breath.
Ooh.
And
I wouldn't mind the fruity breath.
Yeah. It's a weird thing. I've had ketones before, and it's like a
And that was how
taste.
they figured out for sure that you had it. Okay.
So a lot of times when you're diagnosed, you're spilling ketones is what they call it, in your urine. And for a while not even when I was first diagnosed, for a while when your blood sugar is high, they want you to check and make sure you don't have any ketones. Your blood sugar level can still be high.
Okay.
And you can or cannot have ketones. Like, it doesn't matter what your blood sugar level is. It has to do with, like, if there's insulin in your body. So sometimes if you get sick, and you're, like, throwing up a bunch or something, so you're not eating as much. So if you're not eating, you're not really going to take very much insulin. But then when you don't have insulin in your body, then you start getting ketones. So it's a whole complicated cycles that are all interconnected.
You had mentioned that they, like, checked your ketones and then you kept going, which is fine because that was you were answering the question. But I wanted to clarify what ketones were.
Yeah, like if you check, like, the chlorine in your pool or something, it's like a little strip. Yeah, and you used to, like, you pee in a cup and then they dip it in there and it changes the color and there's, like, a little chart.
Oh,
that's how you could do it. You could also check, like, ketones in your blood, but
I feel like peeing on the thing is better than,
you just pee on the stick.
My blood. And then an
endocrinologist.
I keep trying to add another syllable in there, if you notice. I kept trying to say
An endocrinologist is a doctor that specializes in the endocrine system, which basically is hormones. So, like, thyroid, pituitary, and your pancreas, because insulin is a hormone. Your pancreas also does other things, and there are other hormones there. But so they're the ones that are going to specialize in diabetes. The endocrinologist, and you are supposed to see them. I mean, it kind of depends on your doctor, but generally every 3 months you see.
Do you go to the endocrinologist? Do you see yours every 3 months?
Sometimes it goes a little longer than 3 months. Actually, my newest endocrinologist, she's super cool and very chill. She started only wanting to see me every, like, 5 or 6 months. So
nice.
that was at her suggestion, so I was all for that.
And she has a new doctor because of the fact that she has moved recently, not because of anything.
Yeah.
Not because of any other health issues or anything like that. I just wanted to.
Yeah.
Okay, so back to some more questions.
Yeah.
No more definitions for right now. What are some foods that you should avoid, and can you drink alcohol? And that seems to be a big question.
As far as foods to avoid, my philosophy and mindset, and actually what I was taught in the hospital when I was diagnosed, is really that there's nothing that I have to avoid because I have diabetes. I mean, there's stuff that, like, everybody should obviously make healthier choices. So that was always, like, my mindset. So really, for me, there's nothing that I avoid specifically. Things that are going to have, like, a big effect on your blood glucose, that you would either, you would need more insulin for, or kind of need to strategize a little bit more, are things that are, like, high in carbs, high in, like, processed sugar. Pizzas and pastas are more, like, complex carbs, so they are going to raise your blood sugar over time more. So something that's, like, super sweet, like a
eat a lot of cookies
or a smoothie, is going to shoot up your blood sugar fast with those, like, fast acting processed sugars. But then something like a more complex carb, like potatoes and pasta, stuff like that, will raise your blood sugar, but kind of over time. So I mean, yes, like, I think everybody should probably be eating less sweets, but it's never been, like, I've never followed a diet or
and you've never
really
had to specifically avoid it. You just have had to take care of it when you're done.
Right, exactly. I just had to give insulin for it, which was always, like, the mindset of the doctor I had that I was diagnosed with, my pediatric endocrinologist. Like, that's what she told my mom, like, in the hospital, because that was the question my mom had. She was like, can she eat? What can she eat? Like, and, at school, like, you're in school, you're in elementary school, people are bringing in cupcakes for your birthday, and everyone's like, can you have this? Like, you can't have this, and you just have to take insulin for it, and kind of plan for that.
Yeah. Also be aware that carbohydrates are not just breads and pastas and things like that. You do have to be careful with numerous other types of foods, because there are carbs
and fruits and vegetables and drinks
not,
that you wouldn't
not
think
as much.
Of. Yeah.
But you do still have to be aware
like
that there are carbs in things that aren't. I feel like that's a misnomer. Or, like, a lot of people just assume that carbs, when you say, carbs or carbohydrates, they assume
like
breads and pastas and potatoes and starchy things. Which have the main source of carbohydrates, but there are carbs in other things.
Yeah, look at your nutrition labels. Like, take a peek and just see. I mean, you can look at everything that's in something, but stuff that you, like, don't think of. I mean, I've had that happen, like, even now after 15 years. I'm like, I kind of tend to, like, guess how many carbs are in something, and sometimes it's surprising. Like, for the most part, I'm generally pretty right, but sometimes I'm like, oh, wow, like, I wasn't expecting it to have that many carbs or stuff like that, so.
And I know for me personally, for what I have and what I do, I have to focus on protein. Is that something for you as well?
Yeah, protein really helps, like, stabilize blood sugar, especially after a low blood sugar, which Amy knows all about.
I'm hypoglycemic, so we kind of...
Which is the low blood sugar.
The low blood sugar.
Which, like, if I have too much insulin, then my blood sugar goes low, and you need to have something, like, fast-acting sugar. I have these, like, little glucose gels, like, literally.
I have,
like,
glucose tabs in my drawer.
It's literally like icing. Like, it's sugar. Like, it's fast-acting sugar. But if you're going to do that, then typically you should have something proteiny afterwards to kind of keep your blood sugar stabilized.
I know from personal experience, too, whenever I start to feel low, spoonful of peanut butter is just it's like a go-to, because peanut butter is very high in protein. So there are things that you can do, but that is, you kind of have to look out for carbs, but add a good amount of protein.
Protein effect. I mean, everything affects everything.
Like,
I feel like the older I get, like, the more I learn that. With everything, like, it's all complex.
Yes. And then, can you drink alcohol?
Yes, you can drink alcohol. You have to be probably more careful than other people, I guess. I don't know what other people think about when they drink alcohol, but obviously you have to take into consideration carbs. You have to take into consideration kind of the effect on your liver, because your liver plays into blood glucose regulation as well, with glucagon and stuff like that. So a lot of times after you've been drinking for the night, you're done, you went to bed afterwards, sometimes your blood sugar can like drop low. Like that's always the fear with alcohol, but it just depends on what you drank, how many carbs it was. I tend to drink like very sweet wines, so they have a lot of carbs in them, so I don't really have a lot of issues with going low. Also, the other side of that is while you're actively drinking, if you are low, sometimes low symptoms can be like mistaken for you're drunk symptoms.
Yeah.
So you just want to make sure like you're with people that you trust. And that like
know
your signs, and just make sure that you have fast acting
because I do know that from personal experience too. I have to watch how much I drink, and in the environment that I'm drinking, specifically in the environment that I'm drinking in, for the fact that I know that if I'm, college, like at parties and stuff like that, I may not be with people who know that I'm hypoglycemic and may not know how to help me.
Right. They
so
just
I have
think
to
you're drunk. Like, you don't want that. And then just...
Yeah. And I still have to be at a level to where I can take care of myself in case something were to go wrong.
Yeah.
I will say something else about Mary. Who I will leave Mary and your Instagram. Yeah. They both have diabetic Instagrams. I was going to say themed, but that sounds weird. Diabetic specific Instagrams, so I will link those down below. But Mary loves breweries, and she's kind of we drink every once in a while, but I feel like she's and so she does talk more about insulin with alcohol and how to handle that. So I will link both of those.
Kind of more effects of like beer and stuff. I don't drink a lot of beer, so I don't really know. Also, it just affects everyone so differently.
It is,
but definitely just, having people that support you. And also, like you said, like I feel like I have to be like well enough to take care of myself. So maybe that's something that other people don't think about when they're drinking, but that's something that I'm always thinking about. Like I don't typically drink enough. To where I'm not able to function, because I have to be making decisions with my insulin all the time and just be with it enough to do that. That doesn't mean that I don't have fun, but...
I feel like the only times that I have gotten to a stage where you would consider me like drunk was I was with my mother, or I've been with you.
Yeah, right. Same.
Like I feel like it's like my mom, because
I've been with my mom too.
And but it's just because I'm completely comfortable and I know that like she's not gonna let anything happen. She'll shove glucose down my throat or peanut butter or whatever. And then I feel like you and your mom. I've gotten the most the most carefree around were those people. Not because I don't trust my other friends, but just because
it's something you have to think about.
Most of them just don't kind of get it. And obviously my situation is very different than Beth's, because I don't have to take anything for mine. Mine is just one of those things where you just kind of have to watch it and hope for the best.
Okay. It's a 24/7 thing. Like, you're thinking about it. Even when you don't think you're thinking about it, you're thinking about it.
Okay. So, some more questions. I had to switch from my laptop to my phone because I thought of more questions when I was not on my laptop. So this is... can you explain what is a BG?
Oh, okay, yeah. So BG, that's an abbreviation for blood glucose. So that is, you have to prick your finger and you get a little bit of blood and you use a little meter and you test it and it will give you a number, and that is essentially the level of glucose in your blood. So a normal range for just your everyday, I don't want to say like normal person, but your everyday not diabetic person, so roughly like 70 to 110. And it can be different depending on what medical literature you're looking at. And then my target ranges are essentially 80 to 120. But for me personally, and it's very personalized to everybody, I would like to stay below 200 is usually my goal. below 160 is kind of really good for me. Like between 95 and 160, I'm pretty happy with that. So a high blood sugar would be
over 200.
Yeah, probably over 200, or maybe like more clinically, like at a hospital would be like maybe 250 and over. It just kind of depends on you and your body. So yeah,
I have had both complete, like, I have been to the hospital with like a 320.
Yeah.
And then I've also been to the hospital with like a 30.
Yeah.
So those are the terrifying moments where
yeah,
your doctors like test it and they're like, that's
like,
a 30, and
you're like, excuse me,
that's not good.
Yeah,
it's a little terrifying.
Definitely have had those moments.
Yeah.
Especially more when I used like my meter more, because you're like waiting, like it counts down and you're like, what's it gonna be? And then if it's something like really crazy, you're like, wow, okay.
Yeah, my mom and I used to take bets on
yeah,
what we thought it was gonna
what
be.
Is it gonna be?
Yeah,
but yeah,
it's okay.
Anyways, I use a continuous glucose monitor, which is a small sensor that sits on your skin. It has a little sensor that measures your blood glucose based on like your interstitial fluid, and it gives you a reading. The specific one that I have gives you a reading every 5 minutes of what your blood sugar is, and it also gives you like little arrows if you're like trending up or down, or if you're steady, like a straight arrow. Yeah,
I'll watch it.
So that's super nice. And actually the specific like pump that I have, insulin pump that I have, also communicates with the continuous glucose monitor, and kind of changes some of my insulin settings and whatnot based on what my blood glucose is. So I can pretty much see what my blood sugar is 24/7 all the time without having to prick my finger. So that's cool.
Which is nice, because
yeah,
I have calluses on my fingers.
Yeah.
I feel like everybody that has to check their blood sugar will have calluses on some of their fingers.
They've got their fingers that they love to use.
Yeah. Mine was always this finger right here.
I pretty much these 3 on this hand and these 3 on this hand.
See,
I never was like a thumb or a pinky.
Never a thumb or a pinky. But I could always get it better out of these 2 fingers than any other fingers.
These ones actually were pretty juicy
for you.
Yeah.
Okay.
You can check your blood sugar on your palm as well, also like up here.
I've never done that.
Too.
That's weird.
There's like different settings on like your poker. So, some of them have it, not all of them, but you can check them. I did my palm one time when I was probably like 12 and was like never doing that again. So.
Okay, so you explained a little bit about your pump and how that pumps insulin into your body. But what are the different ways that you can take insulin?
Yes. You can do multiple daily injections, which is exactly what it sounds like. You take injections daily. You would take a long-acting insulin in the morning. There's 2 types of insulin. Actually, there's more than that, but we're just going to talk about these 2. There's long-acting
the basics, remember?
And short-acting. So you would take a long-acting insulin in the morning or at night. Most people do in the morning. And that actually lasts 12 to 24 hours, depending on which type of insulin you have. So that's kind of working in the background during the day. And then as you eat your meals throughout the day, you would take a shot of... Not
that kind of shot.
Take an insulin injection of short-acting insulin to cover the carbs
from that
you're
specific
doing.
meal.
Yeah, so you can literally use like insulin syringes. They also have like fancy insulin pens where the insulin's like built in to the pen.
Which is what you used to use, correct?
Yeah.
Okay.
Yeah, I've done syringes like way in the beginning.
I remember having some in my fridge at one point.
Yes, yeah. But then I started using an insulin pen just because you don't have to like draw up insulin every time. It's like on the pen, and you just like twist it of how many like units you want to do. You can't really do a lot of like very small increments of insulin on those. I do think now they probably have other options, but when I was doing insulin pens, I think it was like 0.5, 1 unit, 1.5, like that kind of thing. And sometimes in some cases, like you would want to do like 5.25 or something, you know, and you don't have quite that option when you're doing insulin pens. Yeah.
And how long have you been on the pump?
I've been on the pump for Oh my gosh. I think I was 11 or 12 when I first got a pump. I've been through several different types of pumps.
Mm-hmm.
So I don't know how old I am. 12, 13 years I've been on an insulin pump. It's just much preferred to me. But some people love,
but
would rather do injections.
You still have pins
as
a backup.
That's my backup, So
because I remember we've known each other for 9 years. So there have been times where I think you left one here one time and it was in my fridge for a while before we. I was like, my mom was finally like, "What is that?" And I was like, "It's insulin." And she was like,
"Insulin in there."
Do we need to get that back? Yeah, probably. She's got her pump.
So I use an insulin pump, and there are a couple different types of insulin pumps, but the one that I have, so basically it's like a small site on your skin, and there's tubing that connects it to a small machine that you can input insulin into. So like I could click on it and say I want 2 units of insulin, and then that's going to go through the tubing and onto your pump site. Let me stand up. So that's what it looks like. And I always get this question. People are like, how do you shower with it?
Just shower.
If you're connected to this machine, which it's actually waterproof, but I don't take this in the shower. You can unclip this, and then you just shower. Like with that on.
Because the needle is still in your body.
It's actually a small, like, plastic cannula. I don't know if it's made out of plastic. I don't know what it's made out of.
But it's not like a metal needle. It's like...
it's like a little flexible thing.
Tip of a tube kind of thing.
Right,
Because it's got to have a tube to flow into.
Like, similar kind of thought as, like, if you had an IV in.
Mm-hmm.
That's kind of a similar thought. Like, this tubing is giving the insulin into this site.
Since you're standing up, you can sit back down though. And you showed it here on your stomach.
Yes.
What are the typical locations that are okay for you to inject insulin? Because you can't just put it anywhere.
Right. So insulin has to be injected into subcutaneous tissue. So really anywhere that you have a lot of subcutaneous tissue, which your most used ones are going to be the backs of your arms. Anywhere you can kind of pluck up something is preferred. Backs of your arms, the outer kind of thighs of your legs, like here. Your bottom area here, and like back area, and then your stomach.
You've never put it on your back, have you?
I put it on my back. Before, it's not my favorite spot. That's just
maybe
me
I just
personally.
haven't seen you put it on your back.
I don't. My favorites are my butt and my stomach.
Yeah, that's typically where I've seen it on.
Yeah, for my pump, and then for my CGM, which is a separate thing. It's on my leg. So you can't really see it, but I use my legs and my arms more.
That's the one that I typically see on your arm.
On my arm, yeah. Back when I did injections, I did a lot of them in my arm, just because that's easy. And I did a lot in my leg, too. I actually used to hate doing injections in my stomach, but that changed at some point.
Well, so my mom takes Humira, which is a completely different thing, but it's an injection that she has to do, and she hates doing it on her stomach.
Yeah.
Hates it.
Oh, yeah.
So she always goes for her legs, too.
I would never. Like, I did an injection, like, when I was first diagnosed. I did one in my stomach, like, one time, and it just, like, freaked me out. Nothing was wrong. I didn't do it for years after that. It's only recently that I've really started using my stomach more.
Yeah. Okay.
Freaks me out. It just is freaky. Like, there's organs in there. I don't know.
I don't know either. Because you have to pinch it to, like, get it, too.
Yeah.
So I feel like
don't pinch up anything. And that freaks me out.
Well,
that's
I don't know. I feel like you have to pinch.
I think Mary does it.
That's impressive.
I know.
And I will... if I haven't, you've already seen them clips, but I will have, like, close-up clips of the stuff that she's talking about, cool. So that you can see exactly kind of what she is discussing and what she is showing you. and maybe I will show you. Do you have a picture of one of her arm?
Yeah.
And I'll put that in somewhere else so you can know what the monitor that she wears looks like as well. And I have to, something that is also just something that you and I have dealt with or talked about before is I will go to like tap her leg, or I'll go to like, she'll be behind me and I'll like go behind to like tap her stomach, and then I have to go, oh crap, where's your where's your sight? Where's your
I feel like a lot of people do that.
Just because I'm like, it's not gonna
really hurt. Yeah.
And it's not gonna knock the system out because it's clipped in there.
Yeah.
But I still to this day am like,
you're like, oh, wait a minute.
9 years of friendship, and I'm like, I don't wanna break you.
Yeah.
So that's just a little funny tidbit of having a friend with diabetes.
Yes.
And speaking of funny or crazy situations, what is a crazy or negative reaction that someone has had to you saying you have diabetes?
I mean, when I was younger, I feel like in elementary school and middle school, a lot of people, that's kind of a weird one too for me, because people are like, oh my god, I'm so sorry, and you're just like, oh, well. At this point, I'm just like,
it's part of life.
Whatever. But you get a lot of like, you don't look like you're diabetic, or, you know, is it because you ate too much sugar, or you can't eat that, like that kind of stuff. I had a girl in middle school in like the locker room say something like really weird to me. She like asked me if I was gonna die or something. That was weird. It's like, I mean, I guess eventually.
One day. Maybe not tomorrow.
Like me, a little like sarcastic Beth is like, I mean, we all are, but
fair enough.
That's a weird one. Just some weird comment. You know, people are like, oh, like my grandma has it, my cat has it, and you're like, okay.
Yeah, that is something I feel like a lot of people do. They're like, oh yeah, I know this person that knows this person that knows this one that's got diabetes too, so I obviously know about it.
Yeah.
That's not it.
Yeah, I've had like my pump and my CGM like mistaken for like things like nicotine patch, and I got a lot of like pagers. People thought it was like a pager. And one of the very first pumps I had, the first little pump I had, it honestly looked like a pager. Like, it really does, but you're just like, is this the 1990s? Like,
no.
or are we in a hospital? Like, I don't use a pager. I had somebody this was like a few months ago, thought I was a Kohl's employee because like my pump looked like their little like headset system. She like asked me, she was like, do you know where to find blah blah blah? And I was like, huh? And she was like, you don't work here? I was like, no. She was like, I thought it was like the headset. I was like, it's an insulin pump. She was like, oh cool.
Oh, that's so funny. Okay, so also just from something that's happened recently that I was there with, one of my dear friends is from Korea, and she is international, and they may not know everything that we know about diabetes, because I feel like in 95% of the countries that I've been to, it's not as widely talked about or diagnosed as in the U.S. And so it was kind of confusing for her, or like she had a lot more questions about it, her and her husband did. Would you rather people just ask you questions if they don't know, or would you rather them just look at it and be like,
I'd rather people ask questions. I mean, sometimes that's kind of based on just my mood. Like, sometimes you're just not in the mood. You know what I mean? And you're just like, but I knew these people, and they're sweet, and, like, you know, they have good intentions. But sometimes you just, like, don't know what you're getting into with a stranger. When they start asking you questions, you're like, oh, Lord. But all my conversations that I've had with people have been good. And I just prefer, like, asking questions if you have questions. And if it's not too just, like, weird. Like, if we're just, like, passing by on the street and you just like turn around and you're like, hey, what's that? You know, that's kind of odd.
Please don't do that.
You know, it depends. I'm not like offended by it.
The questions that they were asking weren't just what's that, because they think you'd already said you had diabetes. But they were kind of asking you more of like, well, how does it work?
I'm all about questions. That's totally
That's why we're doing this.
Totally fine.
But I just wanted to use that as an example of somebody that was, one, it was a cultural difference in that sense, and then two, they just didn't know a ton about it because I don't think they know anybody with diabetes. Which we talked about after that. that it just seems more widely diagnosed here.
Yeah. I meant to like look up some data because you're right. Like I feel like that's interesting. I don't know what
we'll try and find some information about that and is. I'll link it down below as well, because I do find that that's a very interesting thing that maybe we're missing it.
Yeah, maybe we just don't know.
But from the things that I've seen, I don't think that it's as widely talked about and diagnosed.
Right.
All right, so the last question, we're going to talk about work.
Okay.
What is it like dealing with diabetes in a workforce? Especially, you were a nurse for a little bit.
Yeah.
Well, I say a little bit, for a couple of years.
Yeah. Few years.
That is very, mobility intensive.
Yeah, it is.
And things like that. So what would you say was like the hardest part of working with diabetes, and do you think it's very different for the fact that you're a nurse versus some other type of job? If that makes sense.
Yeah, no, that did make sense. So there's a lot of questions.
Go.
Yeah. So I worked as a nurse in a children's hospital, and I worked, I started out doing day shift and night shift, but eventually I started doing exclusively night shifts. So I was working a shift that started at 6:30 p.m. and went until 7 a.m. in the morning. 3 shifts a week, so 3 12-hour shifts a week. It was a big adjustment, trying to figure out when you're going to eat, especially as a nurse. Like, it's not like, oh, every day I get a lunch break at 12 o'clock. I'm just going to talk about night shift as if it was like a day shift, because that's what it like became to me. Like, I would eat lunch around between like 12 and 3. I would try to eat lunch. It's like 3 a.m. and I'm eating a meal, but that's what you have to do.
It was her lunch because she would wake up.
I would sleep all day and wake up for my shift and stay up all night, and so that was like a day for me.
She was nocturnal, basically.
I was basically nocturnal. It's kind of fun.
2 years.
Yeah, for 2 years.
2 years. That was when I would stay up late and we would communicate.
Yeah,
the wee hours.
We'd be talking. Yeah, so, as far as being a nurse, I say like just need to like let your coworkers know when you need to eat something, if you really have to eat something, or just like really advocate for yourself in general as a nurse, even if you aren't diabetic, because I think it's like a thing where everyone's like, oh, you never get to eat lunch, but like you should get to eat lunch. It's important, or at least sit down and eat something. So just advocate for yourself for that. I would keep like a glucose gel or glucose tabs in my pocket, or like in a bag close by. So if I needed something fast acting while I was working, that was easy enough to do. Yeah, you just have to pay attention to your blood sugar and your own body signs. Like if you're not feeling right, then you need to check and you need to do something about it, because you want to be the best that you can be so you can take care of your patients. But it really helped me to have like a continuous glucose monitor, so I could just look at that and see, oh, this is what my blood sugar is. Like, it's getting on the low side. Like, I would be a little more, I don't know the word, like, aggressive, I guess. Like, my blood sugar wouldn't necessarily be low yet, but I would probably just go ahead and treat it, because I don't want to drop low while I'm working.
Yeah.
Because you're doing stuff where you're moving around a lot, or you're moving patients, or even just talking to patients and families. Like, you don't want to be like stuttering over your words, slow and like sweating and
maybe not
almost passing out or whatever.
Yeah.
But it was a big adjustment.
Yeah,
especially having it like flipped, like being awake all night and sleeping all day was different. But
and do you think that I feel like it's a little bit more stable when you have like an office job, since you're not moving around as much and your schedule's not as wonky?
Yeah,
because you typically get a lunch break.
It's a little easier.
But it's still dealing with diabetes. It's not.
It's a little easier in general, like as diabetic, to have a very like scheduled out day, because then you can really see like what's working and what's not. Like if you're doing something different every single day, like you're waking up at 8 a.m. and then doing this and this one day, but then the next day you're not waking up until noon and doing this, and like, you can't really figure out like what's causing like a certain high or a certain low or something. It's going to be different every day. So I think just having more of a schedule is a little easier. So the like 12-hour shift nurse life was a little rough, a little hard to do, but it's definitely manageable. And there are a lot of people that are type 1 and nurses, and it's pretty cool.
Yeah, I was like, I feel like the other one is a teacher, which is what Mary is.
Yeah.
And I feel like that's a difficult one.
Yeah,
because you're
like,
up and with kids and moving and things like that.
And you're, you know, like your job, like you're like responsible for like caring for these people, so, you know, so you like, have to be your best. You want to be your best.
Both of you
do that.
Had jobs in which your needs kind of are supposed to come second.
Yeah, right, exactly, yeah.
But you're...
Yeah, I mean, teachers have that as well, where they're like, never get to take a bathroom break or have a snack or something.
You are responsible for these people around you, and so, like, their needs are supposed to be first, but you're also kind of like, but I...
Like, yeah, you're like, wait a minute, like, actually...
And I'm also... I also need to take care of myself.
I never really had anything too crazy happen at work. That's good. I mean, I would have a lot of, like... Not a lot, but a decent amount of lows and have, like, juice and a snack, but was usually able to, like...
Her favorite.
Yeah, juice is so good. I would usually be able to, like, sneak into the break room and do that. A lot of times I would try to catch it early before I was, like, actually feeling really bad so that I could treat it and move along and keep doing whatever I was doing.
Well, that's all of the questions that I have. Is there anything else you'd like to add?
No.
Okay. If there are questions that the viewers have, you know, want to ask or have more questions about, please leave those in the comments below, and I will either talk to her and get the answers and respond to your comments, or we will do a second one of these if there are
follow-up questions
or things like that. But also, like we said before, this is just the basics and an overview of her story specifically. Everybody's story with diabetes is different, so I will link Beth's Instagram and Mary's, and you can see the differences between somebody that's been diagnosed since they were little versus diagnosed recently, and how their lives and things like that are different, and how she's currently doing the injections. And so you can see the differences between those two as well. But for further information, I do suggest doing research online. I will link some resources down below for some more information and things like that if you want to do your own research. And I hope you guys enjoyed this video. I hope it was educational to some extent. And happy National Diabetes Awareness Month. November, yay! And we're actually filming this on...
It's World Diabetes Day today.
We're filming it on this day.
You have to wear blue. I'm wearing teal because I didn't have anything blue. And she's got blue jeans.
I have blue jeans on.
Perfect.
There we go.
We did it.
My phone case is blue too. Does that work?
My phone is blue, so we did it.
So I hope you guys enjoyed this video. Please like, subscribe, comment if you have any questions, comments, or concerns. And I will see you guys in my next video. Bye!